Welcome to the Littleton Board of Health Wednesday, December 16th, 2020 virtual meeting on Zoom. I'm just going to go over the Zoom regulations. The town of Littleton began conducting remote participation Zoom meetings pursuant to Governor Baker's emergency order suspending certain provisions of the open meeting law on March 19th, 2020. Since that time, unanticipated legal concerns relating to the open meeting law have been brought to our attention by the town clerk. Those concerns are supported by the Attorney General's office and confirmed by Town Council. One concern is that the chat function allows a parallel text conversation to the board's public meeting. Chat is essentially running commentary that is occurring but is not moderated or followed by the chair. All participants and listeners may not be aware of comments being made because some meeting participants joined by phone and do not see these conversations. Another concern is conversations between residents within the chat room, which are not incorporated into public record. In response to these concerns, the town will implement the following changes, which in no way prohibit any member of the public from participating in discussion and sharing information during a public meeting, and will ensure that all listeners and participants have equal access to this meeting. People that join the Zoom meeting are set so their microphones are muted. If you call in by phone, please use *6 to mute or unmute your phone, so that the meeting can occur in an orderly fashion. We ask that people who keep their microphones on mute so background noises do not interfere with the meeting. If you wish to participate in the meeting, please use the raise your hand function available on Zoom, or if you've called in by phone, dial *9, which will activate the raise your hand function. The meeting host will notify the chairperson of the raised hands, and the chairperson will determine whether and when to allow public comment. When called upon, participants should unmute and state their name and address, and after speaking, we request that the participant return the microphone back to mute. My dishwasher's on. Is that bugging anybody? Can you hear it? Is it bothering anybody? Okay. All right.
It's Dave. It might cause the Zoom to keep grabbing your image. I don't know.
All right. I'll turn it off in a second. So tonight we have no agenda items. We have just the COVID-19 update, and we've got Jim, Katrina, and Mike. So this is good. You said Anthony was coming tonight, Janet?
He did indicate that he was going to attend these when he's able. So I didn't speak with him specifically tonight.
Why don't we, Jim, why don't we go with Jim, see what he has to say? Is that all right? Are you ready, Jim?
Ready.
Okay. Go ahead.
So I guess just some quick updates. The one that's really kind of an update from this morning. The cases march on, unfortunately. Our public health nurse sent me them today. And district-wide, we got a whole bunch more cases today than we had been getting. We had some encouraging signs at the beginning of the week, but I don't know if this is a blip or it's going to continue to go, so we'll see what happens. And it's not just Littleton, it's district-wide. As of the 13th, the state has updated all of the workplace, sector-specific workplace safety standards that got adjusted when the governor made his announcement last week. So for businesses, those standards are up on the state's website. You can go up and take a look. Some of them didn't change. Some of the more significant ones, restaurants changed, office space changed, retail space changed, gyms changed. I think we had a conversation about office space. Probably the most significant change in the office space is that masks are required in the common areas when you're moving about your office, the meeting rooms. The only time that they're not required is when you're in your own office and you're by yourself. It looks like they adjusted down the occupancy number. I think it used to be 10 people per 1,000. I think it's now down to 8. So restaurants, some of the significant changes, down to 6 people at a table again, 90-minute max at the table. Masks while you're at the table, except for when you're eating. So those are the big changes with the restaurant. One additional thing that I will mention, the vaccinations that are coming to the state. We got a survey this morning from the Department of Public Health saying, would you be able to vaccinate first responders? Here's a survey. We filled out, I will fill out the survey, but I sat on one of the DPH meetings today. Nothing for sure, but they're looking to try to have some regional. So this is where I guess we would come in, some regional clinics throughout the state. They're looking for a way to push it to first responders. Don't know anything more than that, but I have been in contact with all the first responders in our district, including the Littleton folks, with some of the questions that were asked of us in the survey to try to put together a vaccination clinic. So as more information comes on that, I'll let you know. Like I say, it was 10 o'clock this morning. We got that email. I sent out a query to the first responders to see what they could do and how they might be able to work with us to do that. I have a location if I need to do it for the region. I just need to get more details from the Department of Public Health. And as the assistant commissioner or associate commissioner, I'm not sure exactly the title is, things are moving fast. So it may come quickly that we find out when we have vaccine to do first responders only. And that's all I have.
Anybody have any questions for Jim?
I just want to, this is Mike. I just wanted to confirm that Littleton the Board of Health can ask certain types of businesses to take additional steps. Is that correct? And require them to take those steps? I just want to confirm.
Lisa, have a question for me, I assume?
Yeah, just to get your input on that.
So I think other communities that have done it, Mike, have done it with a Board of Health, with a public health order. So some of the communities around Boston, I think, have issued orders, and as part of that order, make additional requirements.
Right.
Boston itself, not just communities.
Boston,
around.
Somerville, a bunch of those communities. Yeah. So I don't think Somerville ever went to phase 3. I'm not sure. So, so I guess the long answer to that question was yes, but with a public health order.
Okay.
So let's go back to that, Mike, when we do correspondence or when when we do our member comments about the market basket letter and your concerns. Mike Fontanella, I know I asked you to be here tonight. I was kind of waiting to talk to you. I'll have Katrina talk, and then hopefully Anthony will be on by then if he's coming, Mike. And then, or do you need to get going and do you need to talk?
Oh, I'm fine.
Okay. All right.
There's a storm coming. I'm not going anywhere.
What do they end up doing? What's going on for tomorrow? Remote learning all day?
No instruction at all. A full snow day.
Nice.
Well, that won't always be the case, but the superintendent felt it would, for a couple of reasons, it would be worthwhile to have the first one be a full snow day.
Mm-hmm. Good. Katrina, are you ready to make your comments?
Yes, as ready as I'll ever be. I'm ready for a snow day. I don't know about anyone else. All right. Let's see. I'm assuming you see my first opening slide. All right, so this is the first page of the DPH's report for today. There were over 5,000 cases again for I don't know how many days in a row. Mainly the cases that are arising again are still age 59 and younger. There's 1,800 in the hospital. Of those, about almost 400 are in the ICU, and 71 deaths were reported today. So this is the graph that we've been looking at of the cases since March. So the first wave, and then we're in the second wave. And what I kind of called out, I don't know how well you can see this. It showed differently on my computer before, but I zoomed in on what's happening since the beginning of November because this really shows the impact of Thanksgiving. So we were pretty flat up until the beginning of November. And then when you look, we really had a sharp increase over the first part of the month. This little dip down is actually the lack of testing, related to the lack of testing over the Thanksgiving holiday. And then this line is nearly vertical. And the last few days trail off because it's a 7-day average and we need a week before that will just keep going up. There's no reason this won't keep going up, but the governor's orders of rolling back to phase 3 step 1 is to hopefully slow this. But given the impact of Thanksgiving on our rates, I can't see how Christmas and New Year's following so close together are not also going to accelerate our spread. So the average daily incidence rate for the last 14 days was 65.1. And 1 month ago on November 16th, it was 20.1. So we are 3 times higher than we were a month ago. It was a big jump, mainly due to Thanksgiving. So you can see that again. Here's the daily confirmed cases for the last 6 weeks. And the last 2 weeks, which this low date is a great marker for Thanksgiving, because there was not a lot of testing happening that day. So you can see after Thanksgiving, everything just it jumped a lot, doubled overall. So it just keeps coming. We have more cases. So this is the cases that rate per 100,000 by age group. And you can see that every age group just is tracking up. This week, this was last week, and I was like, oh, everything kind of trailed off. And then we've had this increase right back up. And in some ways, the slope is steeper than it was before for every age group that we're tracking. The youngest age groups being the ones who are contributing the most to our current spread.
Wow. We know that the Secretary of State had reservations about effort.
All right. And then this is the total number of tests conducted in our state by day. And as you can see, the testing, despite a peak just before Thanksgiving, everything's kind of flat. So we're not testing more following Thanksgiving, but we do have more cases. So the rise that we saw in the last graph isn't related to more testing. It's related to more COVID cases. And then this is the test positivity graph that we've been looking at every time. Test positivity increased from 3.4% just before Thanksgiving right here. And then it is now over 6% or just about 6%. And when you take out this college testing where they're doing the surveillance testing, which is why they can keep their rates flat because they're catching cases earlier, so they're not spreading as quickly. So when you look at everyone else who has access to testing, we are actually closer to 8% test positivity. So that indicates widespread COVID across our communities, the state-wise. And then this is the hospitalizations, daily confirmed hospitalizations. It's continued that here's our peak in the spring. This is where the definition of hospitalizations changed in the summer when Health and Human Services took over from CDC. And then we've kind of been flat, and just this last piece has been tracking steadily upwards, just like our cases have been over the last month. We're now regularly hitting over 1,500 hospitalizations a day now. Keep in mind that, like I've said before, hospitalizations are a lagging indicator. So cases diagnosed today will be hitting our hospitals 3 to 4 weeks from now, so early in the new year. So that 5,400 cases from today is actually it's going to be bad come the new year. So this is relevant to any Board of Health. This is a lot of the decisions that are related to the opening or rolling back decisions are related to hospital capacity and ability to serve and care for the patients that are hitting the hospitals. So it's really concerning that overall in our state, the non-ICU capacity is at 85% full. And that is pretty steady. It's pretty similar across all of the hospitals in the regions of Massachusetts. And then this is the ICU capacity. And this had a jump this week. So it was like 65, I think, last week, and it's now 73% full for the ICU. And then there are more people who are intubated. So the state, again, opened the field hospital in Worcester, but they still don't have all the staff they need. So they're slowly opening those beds as staff become available. They're still trying to hire staff. They are building a facility out in Lowell, another one. So again, they don't have staff for that yet. So once that's spent, I think it's planned to be opened at the end of this calendar month. And then we'll be opening beds as they get staff to work in that facility. And again, they announced elective surgeries, like the non-urgent procedures, will be postponed so that those staff can be redeployed to surge to care for COVID patients. So it's concerning that we're already 80% full or 70 to 80% full, depending on your region in our ICUs. And again, our capacity of our hospitals are hitting because when there's, your staff is rushed, that's when there less care is happening, and more likely that the death rate will start to rise through no fault of our healthcare workers. It's just, that's what's going to happen. That's what happened in the spring. It will happen again. And as you can see, the number of deaths reported on a daily basis, this is the last 6 weeks. So from the beginning of November to currently mid-December, has risen steadily over this last 6 weeks. At the beginning of November, there was around like 20 deaths reported a day, and now there's over 40 reported each day. So the healthcare system, like I just said, if the hospitals get overwhelmed, the death rate's going to rise. It will rise rapidly as we get overwhelmed. So the governor spoke on, I think it was Monday, it could have been Tuesday. And he ran through the data. Now that the data is complete, Pat, it takes 2 to 3 weeks for the data to be complete post a holiday for us to see the impact of the holiday. So the data is considered complete at this point for Thanksgiving. So he indicated that Thanksgiving gatherings had a large negative impact on all of COVID-19 spread en masse, and that put our healthcare system under considerable strain. So he said that for the 1 week after Thanksgiving compared to the week before, Massachusetts had a 96% increase in the number of new cases per day, 93% increase in hospitalizations, 73% increase in ICU, 104% increase in intubations, and 84% increase in reported deaths. So we know that Thanksgiving gatherings were a huge part of why the spread has just exploded across our state. And we're coming up against 2 more holidays where people tend to gather, plus a school break where people won't have school to keep them occupied or work. People tend to take off. So this is concerning if people don't change habits or socialization patterns during this time frame. So this is the contact tracing outreach outcomes for the 2 weeks. This is from last week's weekly report. For the second time in a row, contact tracers have been unable to contact a large proportion of cases. This time it was 37.2%. The week before it was 40%. They also couldn't reach a quarter of all contacts. And these are indicators that the test, trace, isolate contact tracing system is under strain. So if we're not getting a hold of people and telling them they're a close contact, or to giving them instructions about how to quarantine or isolate safely, it just increases the risk of spread in our communities. So this is no fault of Jim or his crew. It's just the system's under strain. And I'm not sure why we're not reaching people. So hopefully this changes. We're going to run into some Littleton in our immediate area rates like we always talk about. So this is the chart from last week's DPH Weekly Report where they look at the towns. As you can see, last week, which is December 10th, we had over 50 cases, which was double the 2-week period before that. So that was a large jump. And then that was actually, so there was a doubling last week, and that had been a doubling from 2 weeks before that. So over the last month, we've doubled twice. It's really concerning. And to keep that in consideration, like there were 234 total cases since the start of the pandemic here in Littleton. And of that 52 cases last week represent 22% of all of our cases. So that came up after Thanksgiving. Like that jump came in the 2 weeks after Thanksgiving. So we have a large spread tied to a holiday that hopefully we can learn from and not repeat.
For things to happen that are way up and up.
Okay, so this is the average daily incidence rate that we calculate for all those areas that we've been tracking. The state was last week, as of last Thursday's DPH report, the state was trending 40% higher. Middlesex County was trending 40% higher. Our border communities had a larger jump than the state and the county. We had a 60% higher. Littleton had doubled, the rate had doubled. So we had even larger jump than our border communities as of last week. And last week was our third week in the red. So we are officially no longer a community at low risk for COVID. The state hasn't updated the list. I'm pretty sure everything's red and they've just given up on that list. So this is to graph it out so everyone can see everything again. After the data pause after Thanksgiving, everything just continued an upward trajectory. Littleton's slope is much steeper than everyone else. So we had a sharper rise than our surrounding border communities. We're now right at the same, as of last week, we're the same level as our surrounding communities. And then we're trying, hopefully we will not catch up to the other areas. But we'll see this week. I threw this graph back in. This is where I graphed our border communities. So Littleton is the bright blue line. The average for our border communities is the black line. And all of the smaller lines are the towns that touch our border. So Acton, Ayer, Boxborough, Groton, Harvard, Westford. And as you can see, there was that period of time in October where we were trending much higher than everyone who touches our border. And then we had those 2 weeks where we kind of we lowered and we hit pause for a while and we rejoined the average, which was great. And we weren't much over it for a while. And then as of last week, we are back leading the pack in the number of cases, which is not ideal. So Jim's sneak peek this week makes me think that we're going to continue leading this pack again this week when I look at it tomorrow. But so we had that pause and we brought it back down to the average. We can do it again if we're choosing differently, but Thanksgiving had a real impact on the rates we see in our town. This is the test positivity for all of those areas that we've been tracking. A number of areas are above 5%, which is one of those thresholds that Harvard Global Health indicated was says there's large spread COVID. So a large spread COVID is everywhere, essentially. Littleton's test positivity was over 5%, and we had the largest jump in that time frame for the 2-week comparison than any of the other areas. So you can see that here again, our slope of our line jumps so much high, like rapid. It's more rapid rise than anything else that we've been tracking, which are pretty parallel, but ours is not. So like we saw with the case graph, the slope rises much more sharply. And this is just another indicator that we have more COVID spreading around our town after Thanksgiving. So this is the sneak peek into Maven that Jim gives to you guys every week in iGraph. And this gives us the hint of what we're going to see tomorrow in the DPH's report. So this week we had, in his Maven sneak peek, he pulled 58 cases over the last 2-week period. So that's slightly higher than last week. It is double where we were in the report just after Thanksgiving. So we doubled. We're still double. We're still on a high. So thinking about this is kind of hard to predict what's going to happen in the next couple of weeks. I think there's a couple things working with and against us. So in the past, we've had these moments of pauses, like we have 2 weeks where we kind of look the same, and 2 weeks we kind of look the same, and 2 weeks we kind of look the same. So we might have a movement up or down next week given the holiday, with Christmas a week away and New Year's a week after that. I think more people are going to be seeking testing because they plan to gather with family and friends over the holiday week. And when people seek more testing, you're going to find more cases. And also with people gathering, there's more chance for COVID to spread. So I think it's quite possible. And given all predictions that I've read from epidemiologists and infectious disease experts, everyone predicts that given the new year, we're going to have another one of those rises similar to what we saw post-Thanksgiving. So I'm hoping people will be mindful and change plans so that we don't have another huge rapid rise in our rates here in town.
Unbelievable.
So just a few things for the public education piece of this. Going back to that contact tracing outcomes where the contact tracers are unable to reach a large portion of cases and contacts. We just please answer the call that you'll get. The Mass COVID team has area codes 833 or 857. I think Jim said Neshoba has come up as Neshoba Board of Health. So if you get a call, please answer it. That way they can give you information of how to protect yourself, family, and your community. So then with more COVID circulating, it's important for us to use as many layers of protection that we can every chance we get. So, washing hands, physical distancing, definitely wear a mask. That helps protect you and helps protect those who you share space with. Checking your health and your symptoms daily. If you've been out and about, if you feel sick, please stay home. Covering your cough and cleaning and disinfecting. These things are all important and they help to reduce the risk of COVID spread, but it does not eliminate the risk. So the safest thing is to stay home as much as you can. And then when you are out in the community, to do the best you can. So COVID, we know from the cluster information that the DPH publishes that COVID spreads easily in households. 95% of all of the clusters identified in Massachusetts are in households. And that's because we share air with our family, and COVID transmits before you have it. So before you're symptomatic. So once one individual in a household is sick, it's highly likely that other family members are going to be too. So here are some ways you can help reduce the risk of spread in your household. So if somebody is sick, trying to keep them to their own space in the house, a separate bedroom, ideally with a bathroom if possible. Do the best you can to keep them away from as many family members as possible. Everyone should wear a mask in the house if someone is sick in your house. That just helps to prevent you getting sick and them getting you sick. Increase your ventilation by opening windows or cracking windows and opening the doors, or just cleaning out the air every few hours. Clean surfaces in your hands often. Consider yourself exposed and quarantine yourself as well. So like we said, everyone shares air and it spreads during the asymptomatic period. So it's very likely everyone in your household is exposed and likely to be positive. So that means stay home and keeping to your family group and away from those, your friends and neighbors and schools and work and things like that. So get tested, call your doctor for help, and then do your best. If you have someone at high risk for severe disease in your house, it's advisable if you can isolate that person in their own section of the house as much as you can to protect them from COVID. So the other thing that comes out of the DPH cluster report is that social gatherings increase the risk of COVID spread. We saw that in the cluster data. We saw in the cluster data, there was an increase in the number of cases arising from social gatherings right after Thanksgiving, indicating that not only did people gather for Thanksgiving, but they gathered in larger groups than they had been for months prior to that. So when you're around others from outside your household, if you do choose to gather for Christmas, it's really advisable to do a true quarantine now and try to seek testing before you hang out with family and friends. But also, if you do, you should be wearing a mask and practicing social distancing. You're limiting your time together, and do everything you can to improve ventilation, like meeting outdoors or opening the windows and the doors. Really, the safest thing to do is to limit your celebrations to those with whom you're currently living with. So the state has created this website and updated this website about holidays during COVID-19 in Massachusetts. And it has a lot of information about the travel order and also ways to reduce your risk of spreading COVID during the holidays. So I encourage everyone to visit this website to learn about how to protect themselves over the next couple of weeks. And hopefully everyone can have themselves a merry and safe holiday season. I'm just going to keep repeating this. Safest option, again, is to celebrate with those who you live with. and to gather with others virtually, a virtual holiday dinner. If you do choose to gather with others, remember to layer up all of those mitigation strategies. You can still do a full 7-day quarantine if you start tomorrow and before Christmas. So that means that you stay in your house, you don't go grocery shopping, you don't go last minute Christmas present shopping, you really stay inside your house as much as you can, use curbside or delivery. If you do need to get something, you're really trying to take yourself and your family out of any public place for the next 7 days. And then you should seek testing before you gather, just to double check to make sure that you are COVID negative before you hang out with your family. So wear a mask as much as you can, maintain physical distance. Again, open doors, windows, or meet outside to improve ventilation. The shorter your visit, the safer. A shorter visit's safer than any multi-day gatherings where you are hanging out in the same household. There was a lot of reports coming out of the summer of like extended family gatherings where the entire family got COVID that had been reported and described by the CDC. And remember that if you do gather over the holidays, that is advisable to quarantine and test coming after that gathering as well. So everyone talks about reducing the risk going into the gathering, but we've got to think about now that you've mixed with other people, you have different exposures. So you got to think about protecting your community and your family afterwards. So really checking symptoms for 14 days and quarantining and testing as long as you can before returning to school and work and things like that. And then here's an updated cheese, Swiss cheese model. And I added this one in because I think now that vaccines are one of our layers that are starting to roll out, this shows the whole gamut of personal and shared responsibilities we have at our disposal. Some of that is the government messaging, things that the consistent messaging across all the boards is really helpful to getting people to hear the same message and start to adopt good public health behaviors. But the vaccine is just starting to roll out. It's going to be months before there's enough people vaccinated to actually start having an impact on our rates. So we really can't relax now. We still need to mask and distance and stay home if we're sick and limit our time in crowds as much as we can. Do all those layers of cheese that we've been talking about for months now in order to protect our community. And there's nothing shameful about getting COVID. I just want to reiterate this, COVID's really sneaky and insidious and it spreads before symptoms appear. So you can do all of these, you can use all of these layers of cheese and you can still get COVID. So it's no one's fault if they get sick. It's just, this is how infectious diseases that spread through the respiratory system happen. So it's really important that we support each other and we try to do the best we can as often as we can. And then going to leave on the Mask Up 01460 campaign. One of the main things we can really do is add a mask every time we're around somebody who's outside of our house. The mask protects you and the mask also protects others. So mask up to keep Littleton open and our schools safe. And that is it for today.
Was trying to interfere, so
thank you so much. Thank you.
Any comments from anybody?
So in a couple of weeks, how many people had the Verizon COVID-19 there?
So Jim reported 58 had COVID in Littleton in the last 2 weeks. That's a big jump for us.
And where it was isolated to school? Was it in home? The elderly? Who got it? Do we know what kind of a group had it?
Unfortunately, I can't see that from the data. I don't know if Jim Gareffi has any insight into that. That would be really interesting to know.
So we're still seeing, again, the multiple positives at similar addresses. So it appears to us, and again, I'd like to say we went into every single Maven case to get a sense of what it was, but the only thing, given the number of cases that are coming in, the thing we're seeing is what we consider family transmission. It's into the house and we'll go through the family.
And you can't tell where the first person in the family was exposed, can you, Jim?
Not usually, no. I mean, depending on who's talking with them, sometimes you can get a sense of where they may have picked it up, but there's not enough to indicate that it was a party or a restaurant, or at least I haven't seen that level of detail.
Can you tell if it's an adult or a kid who gets noticed first?
And again, it is typically we see an adult in the house, then we may see another adult, then we may see kids if there are kids in the house. So that's generically, or generally speaking, that's how that's happening. It's rare that we see the kid first and then the parents afterwards. So.
Do you know if the kids are symptomatic, or is it that the adults are symptomatic and then they test the whole family? Do you have any idea about that?
I don't know that level of specificity. Again, if more than one person's in the house, then generally the whole house is going to get tested.
Okay. Thank you.
Yep.
Jim, quick question. Are the nursing, I should have asked earlier, with the new safety standards, nursing homes, has that changed at all, or did they revert back a while ago to no visitors and things like that?
That I don't know. I know they have testing capabilities in the nursing home now because they do some of their own testing in-house. And you had asked a question about numbers and life care, and I think I've only seen one case since the beginning of November, 1 or 2 cases. So
that doesn't explain it this time.
No, that's not it. No, I think families explain it more than anything else.
I have a question for Katrina.
Sure. Go ahead, Mike.
I'm going to sort of round it up and say recently we're seeing doubling. And going back to shall we say, about a year from now, December, January, February, when things got rolling around in the US and around here, was it still a doubling, or were we seeing 3, 4, 5, 6 over the same time period? The reason I'm asking,
the spring?
Yep.
Let me go pull okay. Reason you're asking, keep going.
No, it's just because there's something encouraging, or shall we say, there's something we're getting a clue of that we could use, or confirms that what we're doing, in spite of the increase in numbers, I want to see whether or not there's something that's working that we can really rely on.
So I'm going to show you the graph. You can help me interpret it. This is the graph with the spring cases, and then now. There are some really big differences in how we detected cases in the spring. So I'm not sure these are directly comparable. There wasn't a lot of testing happening in comparison to now. And the testing was really isolated to those who had severe disease and were in the hospital. So I would say that the slope in November had been similar to the spring until Thanksgiving, and now it's straight up. So I think things have changed. There are more people who are getting it, and so I'm hoping we'll slow down again.
So it's okay. So the clue here is that we've got more efficient testing,
we have more testing.
or more revealing testing.
Yes,
let's put it that way, and we're seeing more than, I'll say, for every infection, we're seeing at the moment a doubling. In other words, we're getting a 2 for 1.
Yep.
Okay. So it's not 1 to 4, it's 1 to 2.
Yeah.
Okay. So we have nothing to compare it with because the method of testing and everything else earlier on doesn't tell us what the doubling was.
Right.
Or whether or not it was 4 or 5 or whatever. And we can't infer anything from the deaths, correct?
No, I think in part because different people are, again, because the age group who's driving this change in risk is younger this time around than it was in the spring.
That's part of what I'm getting at. What I'm interested in is not so much the age group, and I understand what the deaths reveal. I'm just interested, focusing maybe too much on the rate of infectivity or the effectiveness of the virus to do more than 2 for every hit.
Yeah, it does seem like the R naught is still in that same 2 to 6 range that it has been the whole time. We just, we know more now. It keeps staying in the 2 to 6 range. And also that R naught is impacted by all of the layers of cheese, like all the mitigation strategy we do. So we have an R naught of 2, despite the fact that we have masking and better ventilation in places. And we're trying to limit the number of people. All those things are keeping our R naught as low as we can, but it's not eliminating it.
Okay. So by elimination, it thus appears that the real secret of success here is what the mitigation efforts have done is for those folks who managed to stay out of trouble during the first wave and through the summer, they now become the favorite targets of the virus now. So the ironic part here is that those who got protected earlier are now up front and center. I'm just overstating it, but that's the story. So this virus is indeed out of control. Okay.
Unfortunately.
Yep.
Yeah, and like Jim has said before, it's the behavior, trying to keep people home.
And also it reinforces the other point is that there is no stigma, should be no stigma attached to anybody who gets this disease.
Yeah, it can happen to anyone.
It happens to anyone under any circumstances, even the best of. Yeah. And the best that we can do is either early detect or other, shall we say, other efforts to keep it from spreading more.
I feel so helpless. Like what more, is there anything else that we can do as a town, as a board?
I think the town is, at long last, has undertaken a path that can help a great deal by doing surveillance testing. Mm-hmm. Because remember, we're trying to do 2 things at once. We're trying to we're trying to basically reduce the risk, and at the same time keep things open so people can work at their jobs either at home or elsewhere. Mm-hmm. And not everybody has that at-home luxury, I'll call it.
Yeah. All right. On that note, should we talk to Mike Fontanella and Corey about the possible school testing, surveillance testing? Corey, Corey or Mike, did you guys want to say anything?
Yeah, I'm just here in support. If Mike has questions or if anybody has any specific questions, I'm happy to answer.
Okay. I thought Anthony was going to be here tonight. I asked him the other day if he had gotten any more information, any headway on the testing. He said he was hoping to connect with them today, I think. But he's not here tonight. So, and Mike, you said, did you say something, Mike, about it?
We had a good meeting.
On Saturday?
Yeah, on Saturday. And, we all agreed that the best next step was to get with a vendor like Miramis and get more information about cost and, how many tests, what's the right size population. For our population, what's the right number to be testing, things like that. We're still waiting to set up that meeting. But we feel that, before we can really move forward and try to survey the school population to see what the support level is between families and staff, we need to know what to tell them, right? What are we asking them to agree to in terms of the type of testing, the frequency of testing, what the benefit is, what the conceivable costs are, things like that. So that's where we're at. We're just looking to gather more information, get more definitive information that'll help us understand, is this something that, has enough merit relative to the costs and to make sure that we can get the buy-in. And then depending on how that all goes down, we can start to make decisions about, when and if we can do this.
Yeah. So I don't know if you guys knew Kevin and Gino. Mike and I met with Mike Fontanella and Anthony and Cindy and Scott. Who am I missing, Mike?
Kelly Clenching. Well, no, Kelly wasn't at that meeting, but I filled him in.
John Castillo, Corey. I don't know if Katrina, you weren't there, right? Talking about getting in touch with the getting some surveillance testing done in school, and if it's doable and it's affordable, then Mike has agreed that it would be a good thing to do. So, yeah. So we're just working. Anthony, we left. I think we left it at Anthony for Anthony to and John maybe to get in touch with the vendor to see.
Right. And I know Anthony was, and they're just working through the calendar to get a meeting set up. So it's going to happen. It's just, it hasn't been scheduled yet, but the effort is there to get it scheduled.
Excellent. Excellent. Good. All right. All right. Corey, did you have anything else to say about that at all?
No, it's really great. Everybody seems to be on the same page with good action items to move this forward. And I'm just really appreciative. So thanks, everybody.
Yeah, great.
Some good news just popped across. I think all of you will see it shortly if you don't already have it. But apparently the single vials that Pfizer is currently churning out, each vial contains enough for a second injection. So they're going to start looking into the possibilities. That means that if the number of doses that we now have available will be somewhat greater in the millions than we currently would have. This would only affect the speed, if it's true, with which frontline and other folks, healthcare workers, can get. But it also means that the population that gets injected goes up, which means we can start answering questions faster that we couldn't answer before, which one of the big ones is that if you do get the vaccine and it's working, are you still a transmitter or not?
Right, right. Mike, what about the other two? I think there's 6 altogether, 6 vaccines in the pipeline getting ready for FDA approval, or is it just, I've only heard really 3, but I thought I heard a 6.
Well, I'm sure they're churning away because the worldwide market for this is fairly large, or the subsidy for it's going to be rather generous. But as far as we're concerned, the only 2 I know for the US that are far enough ahead so that they're going to benefit not only from being the first, but also they're going to get what we'll call post-approval data, which really locks them in, especially if it's good data. Mm-hmm. So do we
have any idea what's happening in the UK? Because they started a week or 2 ago, right? Do they have plenty, or are they having a hard time getting it?
No, they have enough. Their population is a fraction of ours, and I think the demographics are different, so they might not see the flattening quite as fast as they might, but it's still there.
Yeah. Okay.
And it's going to be a while before the regular, the average little Tonian is going to get their hands on a vaccine. So until that point, like, we can see the light at the end of the tunnel, but we're really, especially these next few weeks and months, we're really still in a really dark tunnel. So while there's hope at the end that we're going to keep moving that way, we still really need to keep practicing wearing our masks, being vigilant, reducing our socialization, all that stuff, so that we can all be around to get the vaccine when it does come to be our turn.
Mm-hmm. All right. And Jim, are you going to use Alex McCurdy's group to do that, or are you using your own people when the time comes?
So we're looking at a regional site. The Boxborough Regency has offered their site for us to use. It's got a great parking lot, good access off the highway. Again, with the dearth of information that I've gotten from the state on this, I don't really know what to do. We have the survey that I sent out to all the first responders, the chiefs, was to ask them how many of their staff, do they have paramedics on staff that could help vaccinate? So I assume we'll use whatever staff we can get a hold of to do that. So again, I need to get a little bit more information from the state before we can really proceed much further. So we're trying to lay the groundwork. In the survey, we have to be able to administer at least 200 doses. They haven't told us if that's 200 doses and then they're going to give us 200 more to do the follow-up. So the survey was kind of laying the groundwork for them to be able to push vaccine out to locals if they thought, and it wasn't something you had to do, but if you thought you could actually get your first responders taken care of. So in talking with our public health nurse, Tamara, we thought it was important to give it a go, and knowing that we have support in our different communities as far as paramedic and MRC folks to give us a hand to do that. So I'm confident that we can pull it off. Again, I just need a little bit more detail from the state about how it might work.
Okay. Any comments before we move along from Kevin, Gino, Mike? Where's Louise tonight? Not here tonight?
He didn't respond to my text.
Okay. All right.
I have one last point. Anthony actually called me today to ask if I would present next Monday at just a quick update to the select board. And he kind of indication of the 5-minute quick highlight reel for them. I'll do my best to whittle that down. But anyway, if you guys want to tune in, you can help me answer questions after.
Definitely.
You ought to charge them tuition.
All right. So any other questions or comments about for a COVID update as we move over along with our agenda tonight? Everybody stay home. Mike, are you going to do another attestation for Christmas break?
Yes, that is the plan to do that. Yep.
How'd that go? How was attendance after Thanksgiving?
It was good. I mean, it was fine. There were definitely families, at least that I heard through the grapevine, who opted to go remote for a week or two, depending on, there's one raise their hand. Whether it was because of what they had, what their plans had been over Thanksgiving, or whether it was what they felt the community's plans had been over Thanksgiving. But generally speaking, and we definitely saw a spike in cases relative to what we had seen. We had only had 4 cases prior to Thanksgiving, and we've had more than that subsequent. But as of now, that spike seems to have receded back to a more normal number based on what it was trending before. Be interesting to see, what the data shows us as more time passes and we go through that. We will be having a discussion tomorrow night at our meeting about, what did we think we learned from the Thanksgiving break and the return from Thanksgiving, and is that going to inform us in anything that we want to decide to do coming out of the winter break?
Do you have the testing on your agenda?
No, because we haven't had a meeting with the vendor, so okay. It's so preliminary at this point. There won't be anything of substantive to discuss at that meeting.
When you do, will you let us know so that
sure.
Get a group together and answer any questions if anybody has any?
Yep, absolutely.
Right. Awesome. Mike or Kevin or Gino, you guys have any questions at all?
I think it was very, very good. The presentation was very well done. And also, I'm surprised we had 58. The question is, everywhere I go, people have masks on it. They have gloves, they have a mask, distance. I don't know how they get sick. I think it's the young kids that are getting sick. They bring it home. I'm sorry to say that.
Okay. Thank you very much. Jim will stay on.
Thank
you. Wait a minute. We still have to deal with the market basket.
Right. I want to talk about that during our correspondence or something.
Okay.
I don't know if Katrina and Mike have to stay on for that, or Corey. No, we're not done yet, Mike. Don't worry.
No, I'm just thought you were.
No, I want Jim to stay on so we can talk about that.
Sure.
Do you want to do that in correspondence now, or do you want to wait until member comments?
I think it's cars. I think we should do it now.
Okay, so we'll do it in correspondence. So Janet was nice enough to send out a letter that Louise had edited, or Jim's letter that Louise had edited a little bit, but I think now it's gone past the time where it's a nice letter to say, could you do this? And now I think we have to, like Jim said, we can make these changes in some safety standards for ourselves and making it a little stricter. And I think we were asking, would you kindly do this? Now I think we have to tell them that they need to do this. So Mike sent me, you sent it to me. I don't know if Janet was able to send it to the rest of the group.
I can do that right now.
Okay.
I wasn't sure whether you wanted that forwarded.
It's a little more forceful, I think. A little bit more detail.
No, actually, my big problem is that I found the changes I made basically is it made the thing shorter because there's something about the attention span of executives for Market Basket. Okay, and the basic idea is that it's sort of like the the armored hand, as it were, to make sure that folks that the CEO and chairman, Mr. Demolis, as well as the local managers, get the idea that this is a requirement that we're asking them to do, and so it's the changes I've made are self-explanatory.
Yeah. So Jim, do we have to send it to corporate, or can we just tell Andy over there at our Littleton store that he needs to do these things?
My take on this is that the way I wrote the letter was the board doesn't have an order that's changing the reopening plan. So at that point, you can certainly ask them to do things. A couple of things. One, I think if you're going to order them to do things, more than just asking them, I think you'd need to do an order. I think you'd need to change kind of the tenor of this. And I think it can't be just targeting, this is something you probably want to run by town council. I don't think you can just target a store. It is unfortunate or fortunate, depending how you look at it. The Market Basket is a busy, popular store. It happens to be your food store, one of your food stores in town. So I guess I would caution you on that. If you want to change the reopening plan, I think you need to do it formally. And I think it can't just be targeting one place.
So you mean...
which letter are you? Which version of the letter to which you're referring?
I only know of one because that's the draft I put together, so that's the only one I know of.
Jim did that draft, and then Louise edited a little bit, but now Mike sent me a new one that I think Janet might have just forwarded to the board. I don't know if she forwarded it to Jim.
I forwarded it to you as well, Jim.
Yep.
Do you want me to read it, and we can see what we think? And Jim, well, you can. Did you guys read it?
I just got it, so.
All right. Do you want to take a second, Jim?
Sure.
Gino, did you read it at all?
You can read it for me if you want to. I only got one computer, so.
All right. Is this something I should read on TV, Janet?
That'd be fine.
Gino, I don't want it going out to the public before we send it to the.
Yeah, that probably would be appropriate, not to just kind of put it out there.
Okay.
Yeah. All right, Jim, we'll give you a few minutes, and the four of us will approve the minutes for December 9th. Can I get a motion to approve the minutes for December 9th?
I make a motion that we approve the minutes for December 9.
Thank you, Mike.
Second.
And we'll do a roll call. Kevin Baker. You're on mute.
Kevin Baker, yes.
Gino Fratelloni.
Gino, yes.
Mike Zeldin.
Mike Zeldin, yes.
And Lisa Flanagan, yes.
Janet, I don't have the updated version of this. There's a bunch of stuff missing from Mike's letter here. Market Basket, if you wouldn't mind resending.
You guys just say the 3 points are blank.
Yeah, those are your points that you made earlier in your
Okay.
I have not changed the requirements.
Okay.
Right.
Because I think they're in line with what we can do. I'm not sure we need to. I'm not sure that town council needs to bless this, but
right.
It's always good to be cautious.
It's capacity. It's one entrance. What was the third one that we wanted to do?
To reconsider the front end display arrangements to minimize bottlenecks when customers are checking out.
Okay.
So Lisa, I'm just curious, the ask that's in there, Mike, is that kind of like a strong ask as opposed to we're ordering you to do that? Is that how you're looking at that?
No, I'm actually, I put it the way I did because I wanted to get it straight, before we went ahead. So I was trying to, I want to make it a requirement. In other words, my ideal situation is to make it a specific order. and it's because of their unique, shall we say, their unique business.
So I think as it's written where you have must ask, I think that letter is okay because it really is just a request. If you wanted to take it to another step, I think the board really needs to consider, and this is the part that may need town council's input, you really need to do an order like other communities have, saying because of the number of increases, because of this, and this, the Board of Health orders. Because I think you may run into, and again, I'm not an attorney, that's why I don't want you to get in trouble. I would recommend having counsel look at it.
Okay, well, let's back up for a moment and ask the following question. This is why I wrote it the way I did, because I wanted to get some idea here from the group. I wish there were more of us. And that is, if the public health aim of this, in my mind, was to reduce a place where not necessarily that anybody's doing anything wrong, but where the opportunity is greater than elsewhere other than the schools for transmission. Okay, full stop. So in other words, this is strictly risk mitigation because of the fact that Market Basket is large enough, its footprint is large enough, and the number of people who go in and out of there are great enough. And also the times in which people go in there is not regulated. It's not like you make an appointment and come in. So from the public health point of view, the question I have in front of the group here is, do we feel that these features of Market Basket warrant an order along the lines that Jim has suggested? That is, we want to make sure that it's absolutely clear they must do this.
Yes.
Or do we want to make it something one step before that? That gives us an opportunity to make it a request and make it clear in addition to the letter that if they don't gently, if compliance becomes difficult, that our board is ready to make it a formal order. So in other words, make it a two-step process than a single process.
Why waste time?
Well,
for lots of reasons.
Standpoint, yeah, for the legal standpoint, I would recommend a two-step. But
I'm sorry. I understand you're thinking from the legal standpoint. I'm thinking from the public health standpoint.
Yep.
Okay. In other words, do you feel also, I think you have a relationship. They know who you are, and I don't want to make your job. I'm more interested in compliance than I am in waving a stick. Okay. It's sort of, anybody can come in there with anybody, but I'm sure we can come with an order and make everybody feel good. But the question is, I don't know what lies ahead in terms of this disease, hopefully very little, much more, but I don't want to make your job any harder to, as it were, persuade them into compliance.
So I don't think that's as big. Just a kind of anecdotal, I shop at a Market Basket in another community, and they already seem to have had the doors closed to one opening already, and they seem to be counting again. So I think whether it's just that store or whether it's stores, system wide for them, they're doing that. I don't know. I am more than happy to go up with a letter, and it's kind of the way you've got it written, I think is kind of a strong ask, which I think is appropriate, and say, the board's really concerned here. And if they continue to see cases in town rising, they may need to actually issue an order, an emergency order townwide to kind of affect the way things are opened and operating in town. That way I don't want to be threatening. I just want it to be, these are the realities that a Board of Health has to deal with this public health situation. We're asking for your help in the situation. Here's the things we'd like to see you do.
Yeah. Okay. And I'm sorry, go ahead, Lisa, please.
Let's make sure that we say this across the board, Market Basket and Donlands. I mean, and any other businesses that we need to, I mean, not just picking on Market Basket, but Donlands needs to do capacity, check the capacity. And I don't know, but I forget what they were like when we were in that phase. Maybe I didn't go there, but did they have everybody going out one exit?
I don't recall. Yeah.
Right.
Okay. Well,
so if we're going to insert Donlands into the mix,
we have to.
Okay, but those are the two largest buildings with the public is going in and out of in numbers greater than 10 per day or 20 per day.
And again, I don't. There's a whole bunch of things that are happening. Obviously, it's the holiday season, so people are out shopping even more. So more people in the store. Again, I don't have a problem going to either one of those stores and presenting that letter and just saying, hey, look at the board's looking for mitigation strategies here. This is one of the strategies they're looking at. If it's not working, the board may need to do other things as other communities have done as far as orders and maybe adjusting the openings. And again, I think that gives you also the opportunity to talk to council about how you might go about doing that.
Yep.
I'm all for the public health standpoint, but I don't want you all in court because
we're not going to court.
Yeah, well, yeah.
Okay, so let me make the suggestion that in the meantime, my suggestion at this point is that we make this a firm but clear request. And at the same time, we take maybe or re-edit the same letter or whatever and use that as a basis for an order and bring it to the council just in case. Because once we get to a certain point in numbers and in spread, we won't have the luxury of a week or two to fool with this.
Is this a phase? What was the phase that we were in when we went back to when we were doing that? Was that?
I think we started phase one. I think they opened, and that's where the occupancies were tight. And I forget when it got loosened up. I think they loosened up by degree as far as capacity and stuff like that. So I'd be lying if I said I remember what the different stages are. Supermarkets have always been open because they're essential.
Essential, yeah.
What they were doing as far as, from phase 1 to 2 and then into phase 3, I'd be at a loss to tell you.
Now, we've since gone back. The whole state has stepped back, right?
Correct.
All right.
But not so far back as we were when we were limiting the capacity in the doors and the entrance to.
Right. So unless they are willing to come, so in this request that we're making, is there a target occupancy that they should be adhering to?
So currently, the rollback to phase 3, step 1, I think, has retail at 40%.
Okay. So in other words, they would have to go back to 40% of max occupancy.
That's right,
correct?
And that's what they need to do now.
Okay. So they need to do that under the state's requirement. Is that correct?
Correct.
Is that a mandate? Is that a legal order?
That is part of the workplace safety standards that they're working under.
Okay. So anything we would do would have to be more stringent. Is that correct?
Correct.
Okay. Is there anything in either of our letters that's more stringent than what the state is proposing?
If it's an ask, if it's a strong ask, I think you're just as a board being concerned and saying, hey, we'd like you to cooperate and work with us.
Okay.
Okay. So Jim, will you go to talk to them soon, or should I, and I'll talk to Harrington about this, town council?
So I think the question to Tom would be, we've made this ask of the two largest retailers in town, because that's, to me, the appropriate way to kind of build this. We've taken this step to kind of a strong ask. We've been advised the next step would be to issue a local public health order, and I think under Chapter 11130, boards of health can do that. How would the board go about crafting that? I don't think it could just be for these two stores, because again, this is the legal question you want to ask of him. You don't want to run yourself afoul. I don't have a problem with the issuing the order town-wide. You just got to be able to treat everyone the same. And I think that's the issue there.
So in other words, the volumes, so in other words, when you say town-wide, so in other words, this would apply to any retail facility, 40% of their occupancy, correct? If it was an order.
And that's how the state's workplace standard works. So now maybe Tom knows that you can, maybe the law supports you saying, hey, look at your big retailers. The board can do something different under the emergency order. I don't have any experience with it, Mike. That's all.
Okay. And the other question I have is that up to this point in time, do we have a record, not necessarily, an incriminatory record, but a record of Market Basket and Donlan's performance to date in complying voluntarily with the state's requirements?
Anecdotal. I don't know that I have anything in writing.
Okay, so in other words, when you visit them and observe that they're not all masking properly, blah blah blah, all the rest, you don't have a log record of that. Is that what you're saying?
I do not, because in most cases when I've been in there, if there's one person, that might be the only person I've seen without a mask.
Okay.
And I usually go up and I have that conversation with the manager.
Okay.
And I think there's been maybe one at Market Basket and maybe one at Donlan's.
Okay. Okay, so we're not dealing here with flagrant or consistent disregard. What we're really trying to do here is reinforce what the state is asking them to do in the first place.
Yes, and I think I mentioned the last meeting was the time I went in with the request to maybe readjust the front end. As I went in, the two managers, the assistant and the manager, are actually doing that real time right as I was coming in. So, I mean, they're taking, I think compliance, they're taking that serious.
Good. Okay.
Okay. So, okay. So Jim, you'll do that?
So I can take the letter, just pop in those, the steps that I had put in there.
Yep.
Right.
Maybe we can get it on Littleton Stationery. I can take it to both places.
Okay. Janet, can you help him with that, or?
Yes.
Awesome.
Do you want me to sign it for the board?
Yep.
Okay.
Sure. Yeah. Yep.
So Janet, if you wanted to put that letter together and just have me as the signatory as agent for the board, I'm more than happy to sign it and take it off.
Okay.
And remember, we have two addresses at the top, Janet. One for Market Basket, the other for Donlan's.
Right. And does it have to go to corporate, or are we going to go just to the store manager?
I guess I'd like to go right to the store manager and have that conversation. And if he says that he would like me to send it to corporate, I'm happy to do that also.
Okay.
Again, in both stores, they've been pretty upfront and pretty cooperative. So I guess I kind of prefer going in and talking to them directly.
Yeah. And from the way the cases are looking, it looks like we'll probably go back to that phase anyway.
It would not surprise me if after Christmas that happened.
Yeah. Okay. All right. Great. So any other correspondence anybody wants to talk about? I know Tim from Park and Rec is on, but we'll get back to you, Tim, in a second when we get to member comments and public comments. Okay. No other correspondence? Okay, minutes are done. Member comments? Anybody? So,
I'm frankly very happy that finally at long last, the Board of Selectmen, the Select Board is catching up with what's going on and wants to understand what's going on in the town from their perspective.
yeah. So when is Katrina going to present this Monday coming up?
Mm-hmm.
Okay. I'll try and be on the audience too. I don't know if Mike, you want to do it. Anybody else?
I'll be in the audience too.
Okay. All right. All right. So member comments. We said nobody has one. We've got Tim from Park and Rec. He's an attendee tonight. He had you guys want to put Tim on? He had emailed me talking about a Santa ride through town, much like they did in the spring with the Easter Bunny. I thought Santa was going to be on the back of a pickup truck like the Easter Bunny, but Tim is proposing that he's on the back of a fire truck. I know that they did this. Tim can explain it a little bit more to you. I saw it in Westford, and Tim said that they did it in Pepperell. I hope we don't have any kids in the audience tonight.
How are you guys?
Hi. I just have to let my dog out. I'll be right back.
So, thank you guys for having me tonight. We were putting this together last week. We were speaking with the big guy in the red suit, and he is doing a ride through with the Pepperell Fire Department on Saturday morning at 10 o'clock. And he wanted to make an appearance and possibly come to Littleton at 2 p.m. on Saturday. And we were going to try to set this up the same way as the Easter Bunny ride, where we were going to do the major streets, hopefully with the fire truck. And then if we have some of the smaller subdivisions, we could do it in the back of the pickup truck like we did last time. The other thought was, the smaller subdivisions, ask those families to socially distance by parking spots in the school lots that they're closest to and just drive through the school lots, just to shorten the route, shorten the amount of time that it took. We had, Santa he was with the COA yesterday at the El Forno pickup. So him and Mrs. Claus were present for that. I'm assuming that you guys were aware of that. It's the same group there. And then we were, going to ask Santa to wear a mask. The one thing Scott when in talking with Scott, he did say that he was hoping to put a firefighter up with Santa just for safety purposes. So that would be the only close contact. In my original conversations with Lisa, she had expressed concerns about Santa and Mrs. Claus being together just to promote social distancing. Santa and Mrs. Claus obviously are from the same household. So just wanted to throw that out there as well. But Lisa had asked me to come up and just, Anthony had also asked me just to come before you guys before we did it. Just saying, come see if there was any input.
Yeah, your story about Mrs. Claus is a myth. So just drop that idea. I mean, it's more than one myth. They're two different people, and they don't necessarily have identical transmission susceptibilities and a whole bunch of unknowns. So they got to socially distance.
Yeah. So
and from not only each other, but also throughout this process from the public.
You understand I'm saying they're husband and wife, correct?
Yep. But if they're going to go out and meet the public, the only people who do that, I don't know if you notice, get tested every day. And I don't know if these people are at that pay grade.
And then, Tim, I was concerned about the grouping on the side of the road to happen to see him.
Yeah, so we had everybody stand in their driveways before. That was kind of what we did before. So it would be the same request.
Yeah, I mean, I think that's better than gathering everybody at a school.
Yep.
All right. You had people standing in the driveways?
Yeah, so when we went with the pickup truck, we went to we just had everybody kind of post their street on the Facebook page, and then we just hit as many streets as we could. So the only thought process by, the other idea of having the smaller groups go to one of the school parking lots was just to limit the amount of travel that we were actually doing. So we can figure that out by, doing a route with the fire truck and then putting them in the back of a pickup truck and going to the more remote spots.
Who's funding this?
Who's what?
Funding this. Who's
So
supplying the dollars for this?
So this would come out of the regular Park and Rec special event budget. So we haven't run any special events all year.
I wasn't questioning how the details. Okay, so you're using a town fire truck to do this event, correct?
Correct.
Okay, so have you checked in? I'm just curious, checked in with, hate to say it, town council, and determine whether or not, God forbid, someone's out there in the driveway. You don't know that. They don't know that. They're asymptomatic. Blah, 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 blah. And someone, someone makes a case that it's all yours. It's your fault. So my question is, I'm just asking whether or not, since you're involving town equipment and town personnel on, a non-government, what's your liability exposure? And it's not just because of the, what you're doing, but it's the risks that are being presented. That's all. So the town understands in your presentation of what their exposure is.
From my understanding, Mike, there's not going to be any contact. You're just going to drop open wave. Right, Mike? Tim?
Yes, correct. It'll be, so yesterday at the COA luncheon, Santa and Mrs. Claus were actually standing on the ground next to a police car. Here, they'll just be driving by the houses. So I would say it's far less exposure than, that event being sponsored and allowed to happen.
Okay, and also you're outdoors, right?
It's fire trucks, so yes.
Yes. No, I wasn't worried about the fire truck. I was worried about
Yeah, so from it, there will be no stopping, Mike. I don't know if you were familiar with the Easter Bunny, but we didn't stop anywhere. We load it, and then we went, and then we unloaded, and that was it.
No, I've seen it. I also know there's other places where they had that kind of event for another infectious diseases, and they managed to somehow get it spread through 4 streets. So it's your order. So I'm a little wary, but I think you're going to drive fast enough through it, so we can hope for the best.
Yeah, I would just say keep to make sure, just keep Mrs. Claus and Mr. Claus separated. Mr. Claus, who am I talking about? Santa and Mrs. Claus.
Or give the public a twofer. They can both do the wave as a word.
And that they have to wear masks, and those masks better be red, because blue or something would just clash.
As per
yesterday, I think they had black ones on yesterday, but I'll see what they got.
No.
Jim, do you have any concerns about this event at all?
I do not. As long as the truck keeps moving, I think that'd be fine.
And did you say you're going to post a schedule about what neighborhoods you roughly will be going through? I sent you a picture of the schedule from Westford.
Yeah, so basically what we did last time was we put it up on Facebook that it was going to be happening. We had everybody who was interested in a visit post their street. And then basically I put together an Excel sheet, and we kind of went through and just posted the times we thought we were going to be close, or we were posting live updates. So probably what we'll do, I'll talk to Scott again. Chief Wazinski tomorrow. And we'll come up with, what route will the fire truck take? And then we'll come up with the, like I said, the more obscure places and cul-de-sacs around the outskirts of town. We'll probably switch back over to the Park and Rec truck, and we'll hit those at a later time. So most likely it'll be probably like Russell Street to King Street to Goldsmith, and then we'll figure out kind of the rest of it from there.
All right. Anybody else have any questions or concerns for Tim?
Good idea, Tim. Good idea.
Thanks, Mike. Yeah, we were just trying to, obviously people can't get to the malls, or hopefully they're not going to the malls. So we were just trying to, get him to the children if possible.
Did Santa go to the Common this year? I can't remember. I know that they had a virtual, I don't remember if he went.
I don't think so.
Okay. All right.
All right. Thank you guys for all your hard work and effort in doing this. I know you have a tall order each and every day, so I really appreciate you all.
Well, I appreciate you putting this together for the kids.
Yeah.
All right. Be safe, guys. Stay healthy. And if I don't see you, happy holidays and happy and hopefully better New Year.
All right.
Bye, guys.
All right.
Thank you. All right. And so now we'll move on to public comments. Janet, anybody in the audience have their hand raised at all?
No, they do not.
All right. Anything else we need to discuss? We'll be here again next Wednesday, the 23rd. And I think we're just going to keep it at 7, correct?
Correct.
Yeah. But we'll all be home, so shouldn't be a problem, right?
Can never tell. Yes, here we go.
Okay. All right. Got a motion to adjourn?
I'll make a motion to adjourn.
Second.
All right. We'll do a roll call. Kevin Baker.
Kevin Baker, yes.
Gino Fratelloni.
Gino, yes.
Mike Zeldin.
Mike Zeldin, yes.
And Lisa Flanagan, yes. All right. Stay healthy and stay safe, and we'll see you in a week.
See you next time.
Okay.